should be on your left side or right-sided heart failure. We'll do our right side first because it's so damn easy. It's just simple as shit to deal with the right side because it's all about the damn lung disease. Okay, if you look at this crazy lady, what picture do you see inside of her belly? What organs? Oh, I color her liver. Y'all know y'all like to color. So the liver and the spleen, because both are enlarged, aren't they? It even makes her belly bigger. Okay, so on the right side, her belly is actually bigger not because her old behind is pregnant. It's because she has ascites. Now, if you look at the ascites, next to that word, put increased pressure in the portal vein. Increased pressure in the portal vein. So that's portal venous hypertension, portal vein hypertension. Increased pressure in the portal vein. Where it says enlarged liver and spleen, you should have hepatomegaly, right? Hepatosplenomegaly or some crap. Then you should be able to look up at the top. It says maybe secondary to COPD. In parentheses, put smoker. But then include sleep apnea and asthma, uncontrolled asthma. Literally write the words, even though they're there at the top. At the core of the problem is a lung disease. At the core of the problem is a lung disease. At the core of the problem is a lung disease or pulmonary disease, cor pulmonale. At the core of the problem is pulmonary disease, okay? Now, distended neck veins, distended jugular veins, JVD for short. You always feel full, so you have your anorexia, your GERD. I would write GERD in there because you have to be clear on why is there GERD, you know. Patients gaining weight, because that's what edema is. It's weight. Water is heavy as hell. Okay, now, something that's very important. You probably want to highlight this. You see where it says increased peripheral venous pressure? On the left-hand side, put CVP, because it's the CVP monitor that actually is going to be elevated. This patient's CVP is elevated. And that's the monitor of choice for this side of the heart, isn't it? Because it's a volume issue, okay? Now, somewhere, I don't really give a shit where, if you didn't do it already, put volume, issue, venous, issue, edema, issue, swelling, issue, venous, volume, inflammation, edema, swelling, and then really big at the top above the right-sided heart failure title, put preload. Okay, y'all, let's keep it moving. On over to your right side. Left, I lied. I do that a lot. Oh, let me put one more thing. I see a little juicy tidbit for you. Go back to your right side, y'all. Let me put one more thing. If treatment is effective, put that at the bottom. If treatment is effective, the patient will have an increased urinary output, because I want you to add oliguria to your list like I did. See here, I put 2 words. They're going to be important in a minute. So if the treatment's effective, this patient will have an increased urinary output, because before that they had oliguria and nocturia. And the patient will be alert and oriented, times 3. Look at her cankles. I can't tell the difference between her ankles and her calves, cankles. Now, let's remind you just something I didn't cover. We are not peeing because, what did I say? You're not getting perfusion to your kidneys either, right? So we're not really peeing. Plus, at night, when we lay down, we get more perfusion to the kidneys, and that is when we get up and pee because our kidneys are actually getting a little bit more blood flow. So just a little bit of that, oliguria. That is not on this side at all. So oliguria would be the only thing I would have to add. Okay, if you turn the page, like you said, we're going to our left side. And this is the typical patient you're going to get. Now, if you look at some of the terms on this patient's handout, this patient has something about paroxysmal nocturnal dyspnea. Paroxysmal nocturnal dyspnea is a lot of $4 words put together, but it basically means it's never ending. We're always short of breath. It doesn't relent. It doesn't give up. It doesn't, lighten up. It's really always there. What you care more about than anything on this page is that the only way to figure out what's going on this patient is the next entry on your left-hand side, and that is a wedge pressure. This wedge pressure, the only way to get it is having a Swan-Ganz, write that, Swan-Ganz. The only way you're going to get a wedge pressure is if you have a Swan-Ganz catheter giving you a pulmonary artery catheter pressure. So a PAC, sometimes we call it. Some of you may have seen that even in clinicals. PAC, Swan-Ganz, same damn thing. You can't possibly tell what's going on this side of the heart without a wedge pressure. Okay? All right, now then, of course, we have pulmonary congestion. Do you see where it says blood-tinged sputum? What should you put there, knowing that's a classic? Pulmonary edema, yep. Remember that the classic for pulmonary edema is pink frothy sputum, because it makes sense. Blood is reddish pink, frothy is the bubbles. That makes sense. Okay, so pulmonary edema. Then if you go over to the right side of your handout, you'll see it has a lot of behavioral terms. Terms like restlessness, confusion. I could add a bunch more. I could say agitation, couldn't I? I could say anxiety. I could say apprehension. I could say all kinds of words right there, and they all mean about the same thing. I could say irritable. All of that's the same damn thing, different day. Okay? Orthopnea, we discussed that you may need 2-3 pillows for the patient to really sleep. When a patient says, I can't sleep unless I sit up in the chair, we probably should get them to come in because a lot of these people do sleep in their recliners, and ultimately that may be where we go with it. But if it's a change for them, it might be somebody that needs to give us a call. So you've had to know that before, hint, hint. Tachycardia, because the heart's working extra hard. You got your exertional dyspnea, your fatigue. Next to cyanosis, I would put syncope, pallor, cold. Syncope, pallor, cold, okay? And I want you to say somewhere on the sheet that this is due to arterial disease. This is actually due to arterial disease. Put on there valvular disease, aneurysm, heart attacks, MI for short, hypertension. Let's make a big deal out of making sure you write atherosclerosis.